There are no approved drugs in AML. It is a disease of the elderly, and typically most patients are given cocktails of chemo. Chemo tends to be very, very toxic. In the elderly, it tends to be very, very difficult to tolerate, and many elderly people cannot withstand chemo. Now, the holy grail and the conventional wisdom in treating acute myeloid leukemia remains: give the patient, young or old, chemotherapy, and then try to get them into a bone marrow transplant. However, in order to go into a bone marrow transplant, the disease needs to be in remission. If the disease is not in remission, they cannot go into a transplant. And secondarily, one has to wipe out the bone marrow prior to a bone marrow transplant in order to get the new bone marrow. With Iomab-B, we can achieve two things in one. We can achieve induction, which means we can achieve a remission, and we can achieve wiping out of the bone marrow or conditioning of the bone marrow. So this is indeed a very, very efficacious way of getting an elderly patient who cannot withstand chemotherapy and most certainly cannot withstand the myeloablative conditioning required before a transplant into a transplant very, very quickly. Iomab can do this in a matter of days versus 1 to 2 cycles of chemo. Typically, each cycle takes 28 to 42 days, so 4 to 6 weeks per cycle. So this is a much faster, better, and cheaper way to get people into a transplant, assuming that the drug gets approved.